Hi everyone. Do you know that today is World Lupus Day? I am here with Marta Mosca, who is leading the ERN, and we are here to talk to you about what is lupus. So lupus is also called SLE. And Marta, can you tell us a bit more about what is SLE?
Oh, for sure. And good day, Jeanette. Lupus is a chronic disease affecting more commonly young women. It is an autoimmune disease that causes inflammation in the body. Autoimmune means that the immune system, the system that usually protects us against the infection, is attacking our body. One marker of autoimmunity, for example, are autoantibodies. And in lupus, we have many autoantibodies, such as antinuclear antibodies, anti-DNA antibodies. Many organs can be affected by lupus, such as skin, joints, kidneys, and very often people with lupus report also about pain and fatigue. Lupus is a very heterogeneous disease, and patients may present with very different clinical picture. So usually what I say is that each patient has his own disease, even though we can find similarities among the different clinical manifestations. And Jeanette, could you tell us how is to live with lupus? I gave you a, let's see, physician point of view, but speaking about patients, how is living with lupus?
Thank you, Marta. Yeah, living with lupus is a highly unpredictable and invisible disease where you have flares and remissions, and you never know what tomorrow brings. You might have a flare up tomorrow, but be fine today. And that makes it very difficult to plan anything. It feels like when you have a flare, it feels like waking up with the flu every day. And people cannot see that you are ill. They don't understand why you cannot do everything you used to be able to do. So how can clinicians support to raise awareness on SLE, Marta?
I think that physicians have to know about lupus because sometimes lupus onset might not be very clear, and this might lead to a delay in diagnosis. Symptoms at the onset of the disease might be very, very generic. So we need to have programs to talk about lupus with physicians and with general practitioners, for example, because when we have a problem, usually we refer to a general practitioner, but not only. So different projects, different education. For example, in the ERNs, we are working on education projects for healthcare providers at different levels so that awareness is raised on this disease, so that we can recognize what we know. And this is really very, very important. As I was saying, for an earlier diagnosis, but also in the management of the disease so that different doctors can work together to treat this complex condition. And Jeanette, how does Lupus Europe raise awareness on lupus?
Yeah, that's a difficult question, Marta. Lupus is a rare disease, and most people don't know what it is. So the only time when you really ask yourself what is lupus is when you get into contact with a lupus patient or you get the diagnosis yourself. We try to run campaigns like the one we're doing now on World Lupus Day. We have webinars, newsletters, and social media, YouTube channel where we try to raise awareness about the disease. But it is difficult to do. What we want to do really is to support the national lupus organizations and help them to refer to reliable and updated information on lupus to help them really raise awareness where they are. So, Marta, what do clinicians need to improve the lives of SLE patients?
So the easiest question, Jeanette, answer, Jeanette, would be new treatments, would be to see patients in organized clinics. Obviously, we need to better control disease activity and we need new treatments. We need to prevent damage, flares, persistently active disease. But I think that in addition to this, to improve the lives of our patients, we need to better understand our patients because there is a gap between the physician point of view and the patient point of view. And my feeling is that we have not yet understood how to mix the different point of views in the process of care. And so I think that here is really something that we need to better understand the patient point of view in the disease and how to put this together with the physician point of view. And I think that discussing this and raising awareness on this might lead us to an improvement in this important aspect. And so, Jeanette, what do patients need to improve their lives?
That's really different from patient to patient, Martha. I think the overall thing we need is access to quality care and treatments. And that might include lupus clinics or centers of excellence and affordable healthcare. Some patients who are not responding to the current available drugs need new treatments targeted to their symptoms.
So it's true, it's a long job and long work we will have to do together. And we are discussing about trying to understand each other, developing new treatments, and this is leading us to research. So if we consider what we have said and we walk together into this, how do you think patients could be involved in research and support us so that we can actually improve the way we treat lupus?
Well, as I see it, there are several ways to do it. So there are really the easiest way is for patients to reply to surveys they see online, to actually help the physicians whenever they ask questions about lupus, give an honest and really, yeah, an answer that can really be used. Patients who live with the condition every day can sometimes identify issues or unmet needs that researchers don't consider. And then at the same time, we can pinpoint possible barriers to participation in clinical trials and maybe find possible solutions. And that way, both patient enrollment and retention is more reliable. So to be able to do this, we need to go more into depth and know more about what is research and how is research conducted. And to do that, we need to speak the same language and educate ourselves within research. And if anyone out there is listening and really interested in going behind the scenes and helping more in depth with research, I can only encourage that you contact the ERN or us in Lupus Europe, and we can help you find the correct solution for you and help you get more educated about what research is. And one of the things that researchers might be interested in is, for instance, the route of administration. So do you prefer to take a pill once a day, have an injection once a week, or an infusion once a month? Those are the sort of questions that you can answer just by being a patient, but sometimes we need to go more into depth.
So Jeanette, thank you very much. It was very nice chatting with you today.
Likewise.
And so we invite you all to raise awareness of lupus, not only today, that is World Lupus Day, but every day, so that no one will say, oh, what's lupus? But lupus will become a well-known disease for everyone, and we will actually learn how to treat lupus better. Thank you very much, Jeanette, for being here.
Thank you, Marta, and have a great World Lupus Day, everyone.